How many of you know that if such flat teeth are there, it can be digitally smiled, designed like this on the computer and get it transformed to the beautiful set of teeth like this? How many of you know that if you have flat teeth, you're suffering from a condition which is called bruxism? How many of you know that a bruxism can cause not only effect to your teeth but also to your head, neck and also shoulders? Yes, my friend, this is possible. And I, Dr. Mayur Khairnar from Precigem Dental World, in this video, I'm going to tell you 3 different important points about flat teeth. Point number 1, how a flat teeth happens in a normal healthy individual. What are the problems associated with the flat teeth? And step-by-step method of converting the flat teeth into a beautiful set of teeth and a beautiful smile with the help of computerized digital smile designing. So, I will present to you this particular case where he was having totally flat teeth. There was lot of sensitivity problem and lot of problem with respect to chewing also. Before I go ahead with the case, I would like to specify what are the 3 major problems which is associated with tooth wear. The problem number 1, the tooth wear is called attrition. You can see in this video where one upper teeth is grinding against the lower teeth and the teeth are becoming totally flat. The case which is we are going to present is exactly the same. The second is called erosion, and this erosion happens because of acids. Acids in the terms, either you are taking a beverages like Coca-Cola, Pepsi, lemonades, everything, or it can be because of acid reflux which comes in your mouth because of the problems with respect to your gastrointestinal tract. The third type of tooth wear can happen because of external factors like toothbrush. If you use very aggressive toothbrush, your tooth can get wear. This is called typically abrasion. So it can also happen because if you are using some needle pin holding your teeth, so this kind of notches can happen. So my friend, these are 3 different types of tooth wear, that is attrition, erosion and abrasion. And we need to understand when the tooth wear happens to certainly severe situations, the patient suffers from multiple problems like inability to chew properly, food lodgement, pain sensitivity, less visibility of the teeth when they are smiling. It also causes pain in the facial muscles, joints as well as in the neck and the shoulder. And people get unknown headache that is called migraine, which people think it is a migraine but its major reason is the loss of teeth structure. And of course the facial collapse. I'm going to give you more insight about the facial collapse soon in this video. So let me continue with the case. This gentleman came to us with totally untreated teeth, and we took the smile picture in front, right and left direction. You can see there is a lot of space loss. So we decided to design this case with a digital smile designing protocols. So these are the before and after results, but I'm going to tell you in detail, step-by-step process, how we define this and we convert back to the original ideal shape. So usually this is after the scans, means we take the impression, the models are prepared and the models are scanned and the scans is transferred into the computer. So this is what you see above me is a scan of a patient into the computer. Then we accordingly, on the computer a digital smile design is made only on the upper jaw, which is called just to test the smile, just to make sure that the way you go to buy a new car and you see and you do a test drive, similarly this is called test smile, where we design your smile into the computer and then transfer that smile into your mouth before doing anything. So you come to know what would be the approximate results in future. It's not like a blind procedure, you will come to know, and this is a science where we calculate your teeth like what you see in above image with the proper parameters, and we measure your teeth in a proper direction, the horizontal and vertical both the directions, and properly with the proper golden ratio your teeth are designed into the computer. These are particularly the shades and shapes of the teeth which is available in the computer library. Those are actually fitted on your mouth, and then you can see now this is step 1. This you can see a blue model above me. Over this a smile is designed, and that's how new teeth are overlapped over it, and that's how you can see the difference. That is, this is just to show you the difference how we can get a result. Now this is step 1 where we do a design smile approach. Okay, so here the test drive is done in the upper jaw, and here you can see the difference. This is just the trial, my friends. This is not the final result, this is just the trial. You can see in the before options there is no teeth visibility, but after giving just a test trial to the patient's teeth are visible and he is expressing it in a very beautiful way. Here, my friend, nothing is done right now to the lower teeth. That's second step, and which we called it functional. Functional means now your chewing will come into consideration. Here in first step we will just check how the smile is looking. In step number 2 we will check how your teeth are going to chew or occlude. Okay, now excessive teeth loss leads to facial collapse. That means if you continuously grind your teeth, your facial height collapses. So let me tell you this. Now this is a facial height. If you see the lady above me, and we have marked 2 lines. That is the line which is at the base of the nose and line which is at the base of the chin. So that is the distance of your lower facial height. Okay, and it is determined by the height of your teeth. Suppose your teeth get abraded or if teeth loss happens, your facial height reduces. So for example, in this case, if you see the upper video, the teeth is getting lost, so the facial height is also getting declined. So now you can appreciate the same lady with a good facial height, and on right hand side you see the lady now here, her facial height is totally collapsed. So can you appreciate, this is called facial collapse, and I'll give you a brief example how a facial collapse can be reversed just by using a second step which is called temporary. So if we now, facial collapse is nothing but loss of space, and now if you see this exactly the upper model which has this is a before model, and if you see the teeth is already collapsed. So in between the model, that's a pink model here above, here we are just opened the space, and this is just next to me is the model which is computerized design. I'm going to show you in detail again. Now this is a collapse bite, the front and right side of the patient. Can you see, this is collapse bite. So the space is there, but it is collapsed. Now we have to find how much space can be opened, and there how can we give you teeth. So space is there. It's a skill of a dentist to find that space, open it and give you a new teeth in that particular space. Okay, so that your muscles will get in harmony with your teeth and you will have the perfect balance of your teeth. So here if you see, we have restored the bite. Restored means we have opened the bite. Now this is opening the bite, respecting your muscle harmony. Okay, it's not just opening randomly. We respect your muscle position, and according to that your teeth is open. In this open bite, we design your teeth in such a way it accommodates, and now your new teeth will accommodate this new bite. So that's how we restore your collapsed bite or your collapsed facial height into a newly designed bite. Okay, so if you can see the differences, collapse bite, restore bite and new digital bite. There is a front and right side, you can see it very clearly. Now you get much difference. Now this new digital bite is printed and then we transfer this new digital bite with the help of a temporaries. This is occlusal, that is a achieving surface. With the help of this temporaries, we transfer into the patient's mouth. Well, you can see this is one of the case which is going on. So if you see exactly, the upper one is the before and the lower one is the after. This functional temporary, still there is to be some corrections which is going to happen. If you see this here in the upper one, the patient facial height is collapsed. See, is opening and is closing. Okay, so that's this one. If you can appreciate, his opening and his closing, his facial height is getting collapsed. Here it is not happening that way because we have restored his height. Here this is this particular. Now this is temporary. This is given to the patient until he get adjusted to the new teeth. Once this temporary is properly adjusted, what is done is we do a proper preparation of a teeth so that you can receive a new teeth on this. After this proper preparation, in the computer, files is given to the CAD CAM milling machine. In the CAD CAM milling machine, the computer mill your teeth, and this milling teeth comes out like this, and this teeth is transferred on the articulator. It is balanced. After that, we fixed your teeth with a very high quality permanent cement. That's the advantage of this cement. It is so strong that it will never ever come out like this. So this is how these teeth are converted into a fixed, permanent, beautiful smile restoration. So you can see this continuously. Upper teeth is been fixed and it is converted now into a beautiful smile and beautiful set of teeth. So you can appreciate that. Same way it is done in the lower arch, where all the teeth are beautifully aligned and now patient can chew properly. See, so here now this case was done by our specialist called Dr. Khairnar. So she is a specialist into that and she is a smile makeover special, and see now patient can chew properly. Now here, this is just to show you, here the cement is not fixed. Okay, so this is the right and left hand side of this patient. On the right hand side, in the lower jaw back side, patient received the dental implants and over that a crowns. So that's how this process is called full mouth rehabilitation. My friend, don't get it confused with a full mouth implant reconstruction. Full mouth implant reconstruction is something different, and if you want to know what is full mouth implant reconstruction, you can put the I button above. But if this is full mouth rehabilitation, especially that means all your teeth are grinded and we are rehabilitating that lost part of your teeth with an ideal shape and form of new teeth and giving you a new therapeutic chewing bite so that you can chew effectively and you can smile beautifully. So my friends, please go through a difference between day one, just the smile trial where only upper teeth were shown just to make you in confidence, and the final smile of the patient where upper and lower all teeth are addressed. Now you can see the drastic difference in the confidence level of the patient, in the smile display of the patient. Here in the upper above me, all upper teeth are properly visible, whereas in the pre-op first one, absolutely only lower teeth are visible. Here the proper smile is designed beautifully with the help of a computerized digital smile designing protocols. So this is happy patients, and this is our team who have designed. She's Dr. Khairnar, and that's our technician, Mr. Hemant. They have designed our smile of this gentleman who is 56 years old, who had all his teeth wear off. Now please listen to what patient is saying after the treatment, what are his experience. Do watch it.
My name is Sandeep Patel. I stay at Dombivli. Initially my teeth were flat, and the behind teeth, I had no teeth behind, and it was very difficult for me to have my regular meals. So as I met my friend Raghu, he recommended me to Precigem dental clinic at Andheri. So I had taken an appointment with them and met Mr. Mayur and Miss Darshana. They diagnosed me properly. So they suggested me for a full mouth rehabilitation with a makeover smile, and to which the charges were also nominal. They were not that high, and I was given a very nice treatment. It was a homely treatment, which, what to say now, there was no pain at all, and I have now all my teeth intact. The upper ones, the lower ones, the behind ones, they are all very nice now, and I am really very happy. I can have my lunch, I can have my meals regularly, properly. The chewing is also become fantastic. So smile is also improved. So I can now people say that the smile you smile now is very different to the smile which you were smiling earlier. So they are also asking me how does this miracle happen. So I've told them this Precigem is the place where I had visited, and they have done this miracle to me. The doctors were really cool, and the staff is also cool, and I will always recommend my friends to, if they have any problem, to visit Precigem dental clinic.
So my friends, if you like this video, do not forget to share it with those people who have such flat or wear down teeth, and this is the best video to show you in a best possible way how to fix wear down teeth with the help of a digital smile designing protocol. Let me tell you again, this is the best video how to fix wear down teeth with the digital smile designing protocols and get a beautiful smile. Thank you so much. Stay connected with us. We'll see you soon again in our channel. Till then, Jai Hind, Jai Bharat.